Hi, good evening. This is Miguel Matute. I'm an occupational therapy student from the University of San Agustin, Florida. And here's my patient, Anthony Valencia. Anthony Valencia has gave me informed consent already. So we already know what we're just about to do. And before I see my patient, I'm going to go ahead. I'm going to go to the restroom really quick. I'm going to wash my hands. I'm going to wash my hands. And then I'm going to ask my patient to lay down on the table facing up, and we are going to demonstrate bed mobility training with my patient. So the first one is going to be supine to sideline. So how this is done, I'm going to have my patient in a good alignment right there, make sure everything's aligned. And then I'm going to ask my patient to turn his head towards his left side, towards the left, yeah, this way. This is called the inverted T position. So make sure your patient has a good flexibility. So shoulders should be abducted at a 90-degree angle, and the shoulders should also be externally rotated. You could come here. So this is how the inverted T position is going to be like. All right. So now I'm going to ask my patient to move his right shoulder across, like in a horizontal adduction position. Then I'm going to ask my patient to cross his leg over. And then now, with the heels of my hams, I'm going to grab here on the scapula and here on the hip joint. Do not use your fingers. And then on the count of 3, I'm going to move my patient over. But before I do so, I want to demonstrate what is called the AP stem. Can you please come? This is what the AP stem is going to look like. So either you come forward with the right, or you come forward with the left. Why is this important? Because it's going to save your back. It's going to make your job a lot easier. So here, AP stand, you can't see, but I already demonstrated. And on the count of 3, Anthony, I'm going to turn you over. Okay, 1, 2, and 3. You cannot beat shot with this. You have to do it. Then. So here we're gonna have a handrail. Ideally, we should supposed to have a handrail. So my handrail is supposed to be up now because I'm going to secure my patient, and also I want to remind about the pressure points, right? Pressure points are important because those are the places that my patient could have any problem with skin integrity, lack of circulation, ulcers, open wounds. So you want to take care of those. So I'm going to do a nice C shape with my towel, and I'm going to put this between the 2 medial malleola. In fact, so we have the medial malleola will be my first pressure point. We have the lateral and the medial condyle of the femur. We have the greater trochanter. We have the rib cage. You can't see it, but it's over this way. We have the rib cage, and then we have the lateral epicondyle of the humerus, and then we have the tip of the shoulder. Come this way, please. So tip of the shoulder, coming process, lateral epicondyle. I'm going to reposition my patient a little bit more to the side. Good. So lateral epicondyle, tip of the shoulder, coming process, greater trochanter. Right here, lateral condyle of the femur, lateral malleola, medial malleola. My handrail up. I can add this if I want to avoid any rotation component. A lot of times it's because of the lack of strong stability. And then if I want to, I want to add another one here in front, and then I'll ask my patient to hold it. And remember, handrail up, and that's how you secure the patient. So now let's do the second one. The second one is going to be prone to supine. So Anthony, I'm going to ask you to lay facing down for me, please. Lay down. There we go. Nice. So always make sure on this one, you want to make sure your patient's head is away from the motion. So if I want to turn my patient towards me, my patient will be looking that way. And then Anthony, now I'm gonna ask you to cross this leg over the left. Good. Left over the right. Yeah, left over the right. And then you're gonna tuck your hands underneath your hips. Good. So now I'm gonna go ahead. Do not use the tip of your fingers. Use the heel of your hands. Same thing. APS 10. You can't see it, but I already demonstrated on my first bed mobility that I was doing. So hip joint, shoulder joint, same thing. APS 10. On the count of 3, Anthony, I'm gonna turn you over. 1, 2, and 3. Good. So handrail, very important to secure your patient. Keep your handrail. If it's down, then you want to bring it up. And same position. I always want to make sure about your pressure point, which I already mentioned when we did the other back training mobility. So we have a pedal here, and a pedal on the back if you want to, and we have a towel roll here, just to ensure that you have those pressure points that you get off. So the last one is going to be supine to prone. So I'm going to have my patient facing up, please, face up. And this is similar to supine to sideline. We're just adding the prone at the end. So I'm going to ask my patient to look this way, look to your left. Good, same thing. Inverted T. You can come this way if you want. So that will be my invert tip. Oh, he already knows. So right here, bring your shoulder over, across, horizontal adduction, bring this leg over, great. And then again, use the heels of your hands. APS 10, very important. On the count of 3, 1, 2, and 3. So don't be afraid, don't be shy. So you just gotta do what you have to do, right? And then here again, handrail, secure your patient. So the only difference here is that you're gonna go around your patient. You're gonna hold your patient, always hold your patient. Don't let go. My handrail is supposed to be up. Go this way. And then I'm gonna have my patient here. And I want to reposition my patient towards the middle. That's 1 point. Just relax your hand down. Okay. Right here by the hips. 1, 2, 3. Here, 1, 2, 3. Let's do it one more time. I'll make sure it is right in the middle. Good. 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 So now I'm going to turn my patient over slowly. Good. Now reposition him one more time. Bring your arms down. Right here, the hips. Come on. Move your hands out. Good. Hips. Hips. Uncross your legs. And then, that's basically it. You could put a bolster here, which I don't have it right now. But you could put a bolster here just to take pressure off from patient's low back and the dorsal of the foot. That's basically it. Thank you for watching my video.